Hello everyone, this is Dr. Sushma Sarila, consulting homeopath at Fidelis Homeopathy. Now let us see what are the risk factors associated with myolysis. Remember, any treatment option, the benefit should outweigh the risks or the side effects of the treatment. If the risks outweigh the benefits, then that is not a proper choice of treatment. But here the risks outweigh the benefits, so it cannot be a proper choice of treatment. Why cannot it be, and what are the risks? Let us see. Infection. See, because we are doing a puncture or hole in the abdomen, it can become infected, right? So even if they're doing it under sterile conditions, after the operation you will be admitted into the ward, right? So bacteria are everywhere, you can get infection. They will be giving you antibiotics, and antibiotics always need to be taken with proton pump inhibitors so that you will not have gastric symptoms. And also by taking a lot of antibiotics, your gut microbiome is disturbed and it is destroyed gut microbiome. What will it do? It will not help in absorbing the nutrients properly. So improper absorption of nutrients, your health can deteriorate. And also by using a lot of proton pump inhibitors and antibiotics, you can get acute gastritis as well. And also disrupted gut microbiome can cause stress, can cause physical stress on the body, which can lead into production of certain hormones, which can lead into hormonal disruption, further by enhancing or helping in it recurring the fibroid. Okay. And the second thing is adhesion. This is very important. If the infection is not controlled, if you're not in a healthy manner and the infection is not controlled, as you can see here in the picture, the body has a mechanism where it restricts the infection by putting adhesions or plasters on it. As you can see here, you can see the plasters, right? So if the infection is not properly taken care of, it can cause adhesions. Adhesions are very important and very risk factors, because adhesion can cause improper movement. If the uterus is adhering to the colon, it can cause severe pain. It can cause pain even while defecating, because there is peristalsis. And also if the uterus is trying to contract, because of the adhesion is not able to contract, you will experience severe pain. You have to do another surgery to remove the adhesions also. And also if the adhesions are too much, then you have to remove certain parts of the body also. So this is also one of the risk factor for myolysis. Apart from that, failure to resolve symptoms. Remember that though myolysis is a very easy way of doing a fibroid removal, it cannot always sometimes decrease the symptoms of fibroids, because it cannot effectively shrink fibroid. Then the recurrence of the symptoms can also occur, and also the present symptoms can also not stop. So myolysis has this problem where there is failure in certain cases. Symptoms are not resolving properly, and also the fibroids are reoccurring, they're enlarging even after that, or also the fibroid can become infected, and then it can start falling off after the shrinkage. It can fall off through the vaginal opening, which can cause severe pain, infection, septicemia conditions also, if that is not taken care of properly. Another surgical risk like hemorrhages, hematoma is common, any surgery. Effectiveness and long-term outcomes. You have to understand that myolysis cannot be an effective form of treatment, because there is a recurrence of the symptoms even after myolysis, because myolysis does not do anything to the cause of the fibroid itself. So effectiveness and also long-term outcomes, we do not know that even after myolysis is done, we do not know what the sources of heat or the cold or the ultrasound waves or laser or radio frequency can do to the uterine tissue, and we do not know how it will react. And if you're someone who is a teenager, who is not yet married, or if you're someone who's married and is planning for pregnancy, that might be a problem, because we do not know how it is going to affect the mother and the baby during pregnancy. So we do not know the long-term outcomes of it. And also the major thing or the risky factor is that even after myolysis, you can have a recurrence of fibroids again. So these are some of the risk factors of myolysis. If you're someone who's suffering from fibroids, adenomyosis, endometriosis, PCOS or PCOD, or if you're someone who's suffering from bulky uterus, dysmenorrhea, Bartholensis, any of the female reproductive organ diseases, you can contact or you can choose Fidelis Homeopathy, as we have high success rates. Here we have two kind of consultation options. The one is the online consultation option. The second one is the offline or the in-person consultation option. If you're someone who's staying nearby the nearest branch of Fidelis, you can come and contact us in person. But if you're someone who's staying far away from the nearest branch of Fidelis, you can contact us online through audio consultation options or through the video consultation options. And after the doctor consultation has been done, we will ask you for investigations, whatever are needed for your condition. And if you've already got those investigations done, you can share it with us. After this whole procedure is done, especially to the online clients, we will be delivering you our medications to your doorstep. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. If you're staying anywhere else across the globe, it can take 4 to 8 business days. We're mentioning here clearly it will take business days because holidays and other things are not included in this. Particularly 3 to 4 business days is what we are proposing. If you're someone who are suffering from female reproductive organ diseases and you would like to get in touch with us, you can call us on this number. You can WhatsApp us or message us on this number. If you're someone who wants to know more about Fiticus Homeopathy, you can check our website www.fiticus.com. If you're someone who's suffering from fibroids, if you're someone who's suffering from endometriosis, adenomyosis, or if you're someone who's suffering from bulky uterus, dysmenorrhea, PCOD, or any other female reproductive organ diseases, and you would like to choose homeopathy because we've told you how homeopathy works best for all of this, why should you choose Fiticus Homeopathy apart from other homeopathy doctors? Remember that Fiticus Homeopathy stands for highest chance of health. Here, compared to other doctors in homeopathy, we have highest success rate. We have top-notch doctors and we are treating it with high success rate. First thing. Second thing, we have transparent treatment. What do you mean by transparent treatment? We do not have any gray area between the patient and the doctor. Here we will be talking to you about your prognosis and also about the condition of your fibroids also, and also the personal care here at Fiticus is top notch. So if you want to choose health, if you want to choose cure, if you want to choose a doctor who is going to address all of your issues, answer all of your queries, choose Fiticus Homeopathy. Thank you.
Fiticus Homeopathy.